Hi, I will be talking about laryngeotracheobronchitis, also known as croup. A disease process. Viruses are present in 80% of croup cases, with identified pathogens. Parainfluenza virus type 1 through 3 accounts for 75% of all cases, with human parainfluenza being one of the most prevalent. Other viral causes include influenza A, B, adeno, RSV, rhinovirus, and enterovirus. Viral infection in the subglottic region of the laryngeal mucosa causes inflammation and edema, limiting the movement and results in discomfort and stridor. Bacterial croup is less likely and much less prevalent and can be caused by Mycoplasma pneumoniae, Corynebacterium diphtheria, a recognized historical cause of croup that is now uncommon in immunological populations, providing reassurance about its rarity. Type of infection, agent, makes little difference in treatment. Croup affects approximately 3% of children in the U.S. every year, mainly between the ages of 6 months and 3 years old. Most cases presented to the ER are mild, with less than 1% considered severe. However, 7% of hospitalizations in children under the age of 5, costing $57 million per year, which imposes a significant financial burden on families. Up to 77% of hospitalizations that do not require inpatient respiratory therapy, which is a vast waste of hospital resources. Pathophysiology and infection. A known pathogen causes edema and widespread inflammation of the upper respiratory tract mucosa, including the larynx, trachea, and bronchi, followed by the epithelial necrosis and secretion. Parainfluenza virus also causes chloride secretion and prevents tracheal epithelium from absorbing sodium, contributing to airway edema. The subglottic area narrows, causing barking cough, stridor, and chest retraction. Further narrowing can cause asynchronous movements of the chest wall, exhaustion, and potentially hypoxia, hypercapnia, and respiratory failure. At night, the problem usually gets worse. The impediment is frequently relieved by cool, humidified air from the shower, croup tent, or humidifier. Complete healing takes a few days. The infection typically resolves on its own. Risk factors include age. Croup is more likely to strike in children between the ages of 6 months and 3. Children are more likely to get croup symptoms because of their smaller airways. Sex. Croup is more common in males than females, and a previous history of croup. It is common for croup to reoccur with future viral infections if you have a previous history of the condition. Major signs and symptoms. Symptoms typically arise unexpectedly in the night, accompanied by a distinctive barking cough. Upper airway obstruction can cause symptoms like stridor, raspy voice, and shortness of breath. So signs would include barking cough, hoarse voice, inspiratory stridor, restlessness, and dyspnea. Symptoms would include fever. Children can experience fevers up to 40 degrees Celsius or 104 degrees Fahrenheit, a systemic sign of infection secondary to the causative viral illness. Diagnostic testing is generally not indicated. It can be diagnosed with simple history and physical, but the test could include a viral culture. A fast antigen testing are recommended for patients who have not responded to initial treatment. A CBC can separate croup from other bacterial causes of stridor, such as bacterial tracheitis, epiglottitis, peritonsil abscess, and retropharyngeal abscess. Although it's not specific, lymphocytosis may indicate a viral infection. A carboxyhemoglobin level can aid in detecting cases of heat injury and smoke inhalation. Thank you.